afternoon. I'm Robin Wittenstein. I'm the CEO here at Denver Health, and I would like to welcome everybody and thank you for being here. Today is a day when we can remember the people that we have lost in our community from the disease of addiction. August 31st is a day every year that we remember through Overdose Awareness Day as an international effort. Remember the people we have lost, help to educate our communities and our families about overdose and the ability to intervene and prevent, and to help reduce the stigma of drug-related deaths and addiction so that people can reach out and can get the help that they need before it's too late. Here at Denver Health, we are tremendously committed to doing something about what is a very real public health crisis. But we don't do it alone. The fact that this march took place today, that the Harm Reduction Action Center helped to organize and bring together people is amazing. And I think every single person here should be proud of the work that they are doing, not only for the loved ones that they have lost, but also to help everybody else who has faced that situation and who deals every day with the pain and the grief of having known and lost somebody that you cared about as deeply as you do. Denver Health wants to make a difference. Our Center for Addiction Medicine is an initiative that we are using to help overcome the disease of addiction and to help prevent overdose deaths. The most important message that I would give to everybody here and to everybody who hears this, there is no wrong door. If you need help anywhere you come in Denver Health or to any of our partners, to the Harm Reduction Center, to the City of Denver and the many agencies, including the courts and the District Attorney's Office, people are ready to help and to put out their hand when you need somebody to be ready to step forward. So I hope the message goes out. There is no wrong door. If you are struggling with addiction, if you know someone who is struggling for addiction, put up your hand and say, I need help. Because who among us has not at some point in their life needed help with something? And this is something we can do something about. Thank you. It is truly a sad statement that we have 1,111 faces here of the people who lost their lives in Denver in 2018 to drugs and to drug overdose. In 2018, our paramedics administered medication, the opioid overdose reversal drug, naloxone, more than 700 times. That is 700 times more than we want to have to do that. But we're glad that we can and that there are other people in our community who do that as well. Whether you are an emergency room physician at Denver Health, in our behavioral health division, a social worker, someone in our clinics, anybody associated with Denver Health, and again, anyone in one of our partners, we are committed to having the right combination of physical and behavioral health so that we can deal with this crisis of addiction. But we've got a lot more work to do. And I think that one of the most important things we can do is make sure that we stop. We take time to remember the people who have lost that fight and to make sure that next year we will not have 1,111 faces on this lawn. So I'd like to ask everybody to please join me for a moment of silence, to remember all of those that we have lost and the people that we want to make sure we don't lose in the year coming forward. Thank you. And the most important part of the program today is really to hear the story from a very personal perspective. So I'd like to ask Britni to come up to stage. She's a client at Denver Health, and tell us her story and make sure that we all remember that this is not just statistics. These are people that we care about. So thank you.
Afternoon, everybody. So I'm just going to start. I was thinking about the silence of stigma, and I came up with this quote. The only way to silence the stigma surrounding addiction is to speak out and educate the minds of the naive and the hearts of the ignorant. In our culture, we have a common saying, the blind cannot lead the blind. Yet somehow, this is an acceptable way to deal with anyone suffering from addiction, mental illness, or homelessness. I believe we stigmatize others out of our own fear. We look over our fellow human beings and judge them based on our own perception of their plights or problems. In our pursuit to distance and protect ourselves, we end up decreasing that person's value and worth. Without a sense of worth, it is impossibly hard to see the point of saving something, even when that something is you. Addiction affects humans of every kind, from every walk of life. This is my journey to recovery. I grew up here in the Denver metro area. My father worked for the state and served in the Army. My mother was a nurse and center of my world. Growing up, life seemed normal. I remember feeling extremely lucky that my parents were still married. As my partners in crime as children, today my siblings have all become outstanding individuals, and I am blessed to be counted among them. Growing up, I was also a victim of circumstance. In a whirlwind of domestic violence, drug abuse, and sexual abuse, I survived a very difficult life, resulting in extensive trauma, chronic homelessness, and substance abuse. Due to my difficult upbringing, I developed a core belief that something was inherently wrong with me, and therefore I deserved to suffer for it. I remember feeling like I never fit in and that I didn't belong. Even at home with my family, I always felt like I was the odd one out. I was so very different from my beautiful and athletic siblings that as a child I tried to snuff out my own likes and hobbies to match theirs. But despite my strengths and abilities, I didn't have the passion or the competitive drive required to excel in sports. On the other hand, I enjoyed solitude, playing music, reading books, and writing poems. At 10, my parents separated, and that was pretty much the end of childhood as I knew it. My parents moved out, sucked into the madness and chaos of addiction and mental illness. No longer in the position to care for me and my little brother, we were left with our maternal grandparents. No longer in the position, even so, I was angry. I was confused, and I felt completely abandoned. My mood swings, coupled with puberty, didn't make life any easier. For the next few years, I was bounced around, never spending more than a few weeks at any one place. Moving around remained the only certainty in my life. Fearing any more rejection, I built a fortress around my heart and refused to let anyone in or any part of me out. By 15, I had run out of relatives and family friends to live with. Homeless and alone on the streets, I started drinking and smoking. Living on the street wasn't nearly as hard to cope with than the complete breakdown of my world as I knew it and the trust I had in the people in that world. I was overwhelmed by emptiness, the exhausting worry and unrelenting shame. My inability to speak out and ask for help turned me into someone I didn't know. By the time I was 17, I had a reputation for not turning anything down. 6 months later, before my 18th birthday, I found out I was pregnant. I was declared unfit at the time and lost my son to the system. I fell hard after losing him. No matter how hard I tried to complete my treatment plan, I was unsuccessful. I continued to fall further into the depths of depression and self-loathing. In between suicide attempts, I muddled through my days self-medicating to avoid any further pain, rejection, or loss. I ended up spending the next 4 years in the limbo of addiction, in and out of jail, in and out of relationships. Expecting my second son, I engaged in mental health treatment, but continued to struggle deeply with my addictions. So just months after my second son's birthday, he was taken out of my custody as well. I admitted myself to rehab in an effort to regain custody of him. While there, my older brother stepped in and offered to take my son on as one of his own. As impossible as it was to consider, I knew in my heart it had to be done because he deserved so much more than I could provide for him at the time. Reeling from the loss, I sabotaged myself. I got involved with another addict in rehab instead of focusing on my sobriety. I ended up wasting the next 2 years of my life chasing an addiction and hiding from my own pain. I was sick of the rat race and the never-ending shame and guilt of my past. I was finally sick and tired of being sick and tired, as they say. Living on the streets of Denver, pregnant again, surrounded by drugs and chaos, I was terrified I would never make it out. I needed help. I had been forced, ordered, and threatened into treatment my whole life, but I had never thought to ask for and accept the help for myself. I enrolled in OBHS at Denver Health, January of 2016. My unwavering desire to get help gave me the courage to receive the help I was given. It made things different this time around because I was different. I had discovered an ally in my own worst enemy. The compassionate staff at OBHS helped me save my life by believing my life was worth saving. We all derive comfort and hope through the unwarranted support and understanding of others. Despite who I was, where I'd come from, or what I've been through, the staff at OBHS gave me understanding and support. OBHS is more than a clinic for me. It's my community. It's a community of hope, where we can be a part of something bigger than ourselves while learning to better ourselves. I took the time to attend group counseling, and I developed a second layer of support in a tight-knit support system of friends. All of us on different levels, different roads, different journeys, yet our destination remains the same: recovery. In order to effectively fight addiction, it is imperative to remove the stigma we have of addicts as a whole. People suffering from addiction are not the enemy. My drug abuse and my drug use was a symptom from deep-rooted, unresolved issues and my inability to see myself as anything but permanently damaged. Recovery is not just about being abstinent. Recovery is believing we can learn to live life without the use of drugs and alcohol. The best defense we have against the stigma of addiction are compassionate hearts, and they have the ability to awaken and free those lost in the nightmare of addiction. Thank you. My name is Britni, and I want anyone out there struggling to know that our capabilities lie not in our ability to do something, but in believing we can do it. Thank you.
Thank you, Britni and her health act. I'd now like to welcome Mayor Michael Hancock to say a few words.
You guys join me in thanking Britni one more time for the courage she showed. Thank you, Britni. And your daughter, who just climbed up here on the stage. I understand her shirt says, "I do what I want when I want." Yep, she pretty much proved that true. Let me just say I am honored to be here, and let me thank Denver Health and the harm reduction team and the OBHS team for what they do for Denver and for all of the people who call on them for services and support. I'm going to ask you if you'll join with me in not only thanking Denver Health and Dr. Robin Wittenstein, who is a phenomenal addition to our city and has already proven to be a tremendous leader here at Denver Health. But also to thank all of our first responders, the Denver Fire Department, our emergency medical response teams, our paramedics, the Denver Police, all the medical professionals who sit in our emergency rooms, and even those who are not part of our emergency first responding teams, including our librarians, our social workers, our teachers, our Parks and Rec department teams, who are highly impacted not only by the opiate epidemic and the use that's taking place in our communities, but also the first line of defense and opportunity for recovery, as well as our, I said our social workers, but join with me in thanking all of our first responders and our teammates who respond. I stand today as the brother of a survivor of addiction. Stand today as someone who has seen firsthand the impacts that addiction has, not only on the individual who is fighting for their lives through a very serious illness, but also the family members who are impacted as well. Stand here today as the uncle of nieces and nephews who's watched their parents fall into the abyss and the disease of addiction only to be lost and left behind. As I listened to Britni talk about herself and how her parents were rendered unable to care for her, I clearly understood, having watched my sister try to recover, but having lost her children. But like Britni today, I stand today as a witness that addiction can be overcome. It can be defeated. And that individual who has suffered from the disease and their family members can learn to thrive. I'm proud to tell you today that my sister is 4 years clean, and her children, she called me today, as a matter of fact. She is just a bundle of energy. But her children, the oldest child has received as a recipient of two master's degree, and the wonderful mother of 3 beautiful children. Her son is doing well as a father of 6 children. Her other daughter is doing well as the mother of 3 children. And her baby is doing well as the mother of 3 children doing mission work in Costa Rica. So it can be defeated. And so today I stand here proud with the Denver Department of Public Health and Environment and Bob McDonald and his leadership, having launched the Opiate Response Strategic Plan that aims to diminish the stigma surrounding substance abuse and substance use, eliminate barriers to accessing treatment, ensure equity, create opportunity, and build resiliency. I'm also standing here today to tell you that as a mayor, I was proud to join, under the guidance of our city attorney, to join lawsuits all over this country to stand and to go after these manufacturers who knew the dangers and the impacts that they were creating on our streets, but continued to stand by and to watch it happen under the guise of pursuit of revenue and profits. And so, yes, the most recent lawsuit, the judge's decision just a couple days ago of $572 million, is only the beginning, as there are some 50 plus lawsuits around the country. And I want you to know that your state and your city sit at the pinnacle seats of leadership on those lawsuits all over the country. We are also proud to tell you that we have a leading motto in this city called the Co-Responder Program, where we have our social workers, behavioral health professionals who co-respond along with our police officers, helping people get treatment and not just another night in jail, working to break that very expensive cycle. As a result, our goal is to work to reduce 200 nearly fatal drug overdoses with a focus on our opiates and methamphetamines here in Denver, Colorado. We're going to work to enact recommendations in the Opiate Response Strategic Plan to address substance misuse in Denver. And we're going to implement voter-approved Caring for Denver strategies, which, by the way, thank you, Denver voters, providing those necessary resources so we can address addiction challenges in the city of Denver, as well as mental health, homelessness, and suicide prevention. We are your partners, those of you who are on the front lines. I am proud to be here because, again, as Britni appropriately pointed out, every one of us here, I promise you, has been impacted by addiction. And the reality is that we can together work hard to overcome the addictions. I am proud to stand with the real experts on the front lines, but to celebrate you for all the work that you do. And with that, I'm going to bring up a guy who I've come to really admire and appreciate the work that he does. And that is Dr. Christian Thurstone. Come on up here and let's talk about the outpatient behavioral health services. And on behalf of the city of Denver, we thank you all for the hard work that you do to keep us all safe. Dr. Thurstone?
Thank you, Mr. Mayor, and thank you, Britni, for the wonderful story and the inspiration. Want to thank the Harm Reduction Action Center, the District Attorney's Office, Adult Probation, Addiction Research Treatment Services at the University of Colorado, Behavioral Health Group, Denver Recovery Group, and of course Denver Health, who all made this event possible. Also want to give a couple shout outs. Is the guy here who had the sign, "Yes, we Narcan," still here? My favorite sign, "Yes, we Narcan." And to Dr. Jane Kennedy for my favorite earrings here today. She has Narcan earrings, so makes me want to get my ears pierced. So thank you, Dr. Kennedy, for that. I was asked to give a few comments, brief comments, about stigma. And in researching this week and thinking about this, the short answer is we have a lot of work to do. 63% of people still think that discrimination against people with addiction is not a problem. 43% of Americans nationwide oppose parity for mental health and behavioral health treatment. 49% oppose increased federal funding for addiction treatment. 76% oppose increased federal funding for housing for people with an addiction. And 59% say treatment is ineffective for addiction. So we have a lot of work to do. We have taking a pledge to end stigma over there, and we welcome people to sign that and take that pledge to end stigma. And I think that's important. We need to get information out there like this. I think, though, what's even more important if we're going to end stigma is to put something on top of it that's even better. The human brain does not have a delete button. If I tell you not to think about the most delicious chocolate cake that's moist and warm and full of lots of sugar and cream, what did you just think about? If I tell you not to finish this sentence, Mary had a little, right? That's exactly where your mind goes. So we need to add something on top of this that's even better than ending stigma. We want to be for something. And I think Britni said it as eloquently as anybody could say it, that we need compassionate hearts. What about calling on some common human values that we have around compassion, kindness, respect, dignity, love for each other? Those are the things that we can add on top of this to overcome stigma. Those are the things that are more powerful than stigma. Speaking of love, at Denver Health, we love people who use substances. We treat them with respect and dignity. Last year, we saw about 40,000 patients across our system who had a substance misuse problem. We had about 160,000 patient visits last year in which substance use was identified as an issue. Denver Health has been investing in behavioral health treatment for a long time. While lots of other systems were getting rid of their behavioral health departments, Denver Health has been investing in behavioral health here. And so today we're really excited to be starting up Denver Health Center for Addiction Medicine, which is going to treat people with kindness, dignity, respect, and provide quality care throughout our whole system. And like Dr. Wittenstein mentioned, no wrong door for entering treatment. Thank you. At Denver Health, we also love people even when they don't want to stop using substances. I talked with Dr. Rowan today. I think she's here. We're happy to treat your hepatitis C. We're happy to treat your HIV. You do not need to stop using substances before you come to see us. Thank you, Lisa Ravel, for the inspiration. We love you no matter what here at Denver Health. So in closing, I just thank you for your time. Thank you for being here today. I encourage you again to sign the pledge against stigma. I encourage you to write a memory letter to loved ones that we've lost in this opioid overdose epidemic. And thank you for your time. Have a good day.